Ghana is deeply honored to receive the baton from the Republic of Namibia, which hosted the inaugural forum in Windhoek in May 2024. The gathering marked a defining moment in Africa's collective approach to health workforce investment.
If you ask me, the evidence is clear. Africa has made some progress. The region now has over 5.7 million health workers, and the density of core health professions has improved modestly from 22 to 24 per 10,000 population between 2022 and 2024. Community health workers have expanded significantly, reaching more than 1.1 million in 2024. These gains show what is possible, but they are not yet sufficient. Now Africa faces a projected shortage of about 5.8 million health workers by 2030. Africa must act. We must create jobs, not graduates. We must retain talent, not just train it. And we must call our diaspora home, even only for a season, to teach, to mentor, to transfer skills.
On behalf of His Excellency, President John Dramani Mahama, I warmly welcome all of you to Accra. What we have before us today urges us to move to decisive implementation. I've listened to the presentations made by speakers before me, and I've noted the anguish, the sense of urgency, and the genuine concern about what we can do and should be doing. Yes, we must plan, train, and deploy health workers effectively, employ them sustainably, and retain them with dignity.
If we were to invest a little bit more for health workers, especially for their employment, say $4 to $6 per capita, if each public service minister sitting here can go back and open the post created for health workers by about 30%, by 2030 we can have 1 million more jobs for health workers. And you know what that will do for us? Whatever money we put in will return to the economy 9 times, and our society will be better off 33 times.
In summary, the Africa Health Professions Education Quality Standards, it's a process that is involving regulators from various countries in the African region. We have done the evidence, we've brought together the evidence, we have done the drafting, and what we have come up with is the Africa Health Professionals Quality Standards, which has 9 domains and 32 standards. So this is a work that we are moving ahead, and we are very keenly aware that we need to have the partnership of our institutions across the continent. We want to really align, because what is going to help that movement of professions across is, in fact, I think, within the framework of the free trade area. And that is something that is in the hands of our highest level of political governance on the continent. So we are looking forward to the next steps and to working very closely together so that we can support the policy framework that will make it possible for the mutual recognition of the qualifications to advance the mobility of health professionals across Africa.
Avoir une relation plus tenue avec les structures privées de formation pour que les formations délivrées par ces écoles privées soient à la hauteur de ce que nous attendons en termes de qualité d'agents formés. Et deuxièmement, multiplier les initiatives de partenariat public-privé pour que, à la faveur de ces partenariats qui sont basés sur des infrastructures, on puisse aussi insérer des dimensions de formation pour nos agents. Ce sont les dimensions sur lesquelles nous travaillons à l'heure actuelle au niveau de la RCA.
Women are not dying of disease we cannot treat. Women are dying because societies are yet to make the decision that their lives are worth saving. Let us not forget that health is not only meaning the absence of disease, it's the healthy behavior for a woman to be able to enjoy a healthy and productive life.
And there's now substantive evidence to show that they're good, cost-effective, effective in deploying primary care, preventative, promotive care. The WHO supports this through their 2018 CHW guidelines, where CHWs are to be formally integrated into professional PHC teams with fair pay, training and career pathways, as well as the 2022 Global Health and Care Worker Compact, which commits member states to protect, invest in and ensure decent work for these health workers, including community health workers. And for the next 3 years, the Global Fund Partnership remains completely committed to its mission to advancing the end of HIV, TB, malaria as health threats while investing in resilient health systems.
Are we sure that in Africa we don't have enough money to invest in health? Are we sure when we are making budgets and plans that we prioritize health or we prioritize consumables?
Foi claro que é preciso haver consenso e compromisso de que a saúde deve haver uma participação coletiva de todos.